All right, you're live.
Hi guys. Had to get that one. Okay, so we're doing what a lot of people love, extractions. Little but mighty. So at the end of the day, we're doing just a really good kind of skin maintenance, acne maintenance type treatment. So extractions plus a silk peel. So dermal infusion, silk peel. What that does is it kind of acts like a wet vac. Basically, it's going to suction dirt and oil from the pores while also infusing serums onto the skin. You can have a smooth grit or a little bit rougher of a tip, think kind of like a diamond dermabrasion, to really exfoliate the skin, but it's gentle. So you can actually do it weekly. You can infuse skin brighteners, hydrators, pore clarifiers. So great thing to do. We were just talking a little bit about extraction. So our patient here has started breaking out up on his forehead. The rest of his skin is like really nice and smooth, really even in tone and texture, but has a little bit of congestion. Go ahead and turn your head all the way to the right. So you can see that there's a little bit of very fine, localized oil that gets trapped under the skin. So we were talking a little bit about why this happens and how dead skin cells can kind of occlude the channel where oil wants to come out from deep in the skin. And so the way to get all of that dirt and oil out without really causing trauma, because I don't want patients to sit at home and squeeze their pimples with, well, for one, ever, but with dirty hands, poor aseptic technique. We want you to be clean, make sure that you're getting really good results with little trauma to the skin. So I was explaining that I'm going to use two tools. So this is very simple, an extractor or a lancet, which has this tiny little needle on it, and an extractor. And what this allows me to do is prick the opening of the skin so that everything can come out easily, and then use use really gentle pressure on the skin, kind of applying it from certain angles like this when you're pushing to scoop out some of that deep oil. So let me swap this. Okay, so starting on the forehead, so I want to show you a little bit about what extractions are like. So I don't know how closely you can see here that we have this little kind of brownish pore. We know that there's some deeper oils in there. So just going through and doing extraction. So this one came right out and you can really see that. So imagine that you have your skin with all of this trapped under the surface. If you're able to come in and have these things removed and infuse brightening serums and cleansing serums, you're going to have a much smoother overall appearance to your skin. So extractions are not terribly uncomfortable, but they do involve that little pinprick, and we're able to just clean out lots of oil. So this is going phenomenal. Are you one of those people who like to see this? You are, aren't you? Here you go.
Oh, wow.
So we're going to do a bunch of extractions up here. I just want to show you what it looks like because there does not need to be a lot of trauma with this at all. But he was a great candidate for this. And after, I want to tune in again and show you guys the silk peel. Are there any questions so far?
Nope.
Any pimple lovers going into the weekend? I know you're out there. Okay, guys. So here's our last one for right now. I'm gonna finish up because extractions take time, and you definitely want to take your time with it. Here's a good one. Some of these are not even just pimples. Some of these are milia. So actually, when you look at something like this, they're very like. This one not exactly, but very round, pearlescent. This is just hard oil. So these are sometimes hard to get out of the skin when you're not doing them with a professional. All right, we're making a little collection right now of all our extractions. Guys, I'm gonna finish up here. If you have questions, let me know. I'll tune back in probably 5 minutes when we start silk peel or dermal infusion, and I'll catch you then. See you soon.